Welcome to the Dispense Magazine podcast with news and information about medical cannabis. We talk about the things you and your doctor might talk about. I'm your host, Sven Hosford. There's been an explosion of new CBD products available in health food stores, vape shops, and even gas stations. It is supposed to be medicine, but why do so many users wind up in the hospital? That's what researchers Jahan Marcu and Jan Roberts wanted to find out. The two founded the International Research Center on Cannabis and Mental Health, which, along with the Cannabis Chemistry Subdivision of the American Chemical Society, recently released a report about the safety of unregulated CBD vape products. In this podcast, the report's authors detail the results of the study and their overall concerns for how unregulated CBD products can cause damage to humans and the entire industry. This interview was recorded for an article that appears in the premier print issue of Dispense Magazine. Here's our entire conversation. We're talking today with Jahan Marcu and Jan Roberts, and they have just recently, on November 16th, released a report on the dangers of CBD oils. And they are with the International Research Center on Cannabis and Mental Health and the Cannabis Chemistry Subdivision of the American Chemical Society. Jahan and Jan, welcome.
Thank you. Thank you for having us.
Thank you.
First, let's go through, now you two are co-founders of both of these organizations, or who's responsible for which here?
Well, we both are the co-founders of IRCCMH. It's a long name, International Research Center on Cannabis and Mental Health. We decided about a year and a half ago, we knew that there was an issue that really from a mental health perspective, that there was a gap between what was happening in the lab and what was happening at the clinical side with patients. And I'm a licensed clinical social worker and own a large healthcare organization in the Mid-Atlantic area. We see like 16,000 client visits a year. And so Jahan being Jahan, I introduced myself and said, I think that we need to be looking at this. I'm at NYU as well. And that's how CMH got started.
Yeah. And I was working with a couple of different societies and standards groups, and along with Ezra Pryor and a couple other folks at the American Chemical Society, including Jeff Raber, who has a prominent testing lab and company in the industry, we decided to found this subdivision of the largest professional scientific society, the American Chemical Society. And this is nestled in chemical health and safety issues. And so we were already encountering issues with not only like worker safety and product safety, but worker well-being in cannabis businesses is also a big concern. And so they're also concerned about workers who are in this industry who might be exposed to things that they don't know they're getting exposed to, such as, potential contaminants or adulterants in these products that have like really kind of fantastic potency. And those are other issues that come up as well. And there's been a couple of research reports about, worker well-being in the industry as well. And perceptions of safety and quality of life in their jobs.
So there's some overlap between the two organizations, but they do have
yes. I look at it from, I see so many mental health patients, and I've been able to see how cannabis has positively impacted and negatively impacted my patients. Mm-hmm. And the concern I have is the lack of education, the lack of knowledge that's out there for clinicians, and I'm talking about mostly mental health clinicians as well as patients. And, most mental health clinicians are trained to look at any kind of cannabis use from a substance use lens or a substance abuse lens, and that's something that's very passionate for me to destigmatize, to really kind of look at how cannabis can be used therapeutically and the issues that are around that. Most mental health clinicians think that cannabis is cannabis, if that makes any sense, that there's just one cannabis. They don't really understand the intricacies behind it. And that's kind of one of the passions. And Jahan and I have such different perspectives. It's actually been very complementary because I'm looking at it from how is my patient being affected, and he, obviously you have a lot more knowledge around the pharmacological pieces. And so we just felt like we could really build something that was unique, that would blend advocacy, research, and education into it.
Yeah, I wanted to ask you about the having the term mental health in your title. Do you see that there's a lot more emphasis being placed on the physical aspects, or, as you said, there's this tendency for mental health professionals to only see it through the lens of addiction and automatically see it as a negative thing? Is
that's been a concern for a long time. And I think with almost studying anything, if you're looking for harms, there were changes. The changes must be bad. All change is bad. And so when you look at this data and you see differences, but it's been one of the things that's become readily apparent is that in the literature there are, finding lasting harms from using cannabis is exceedingly difficult. And differences that are found are often not significant, meaning no different than random occurrences. However, what is unfortunate is that despite the decades and decades of research going back to the 1960s, looking at brain scans and IQ tests, we still are not really much closer to detecting or predicting when cannabis will be helpful or identifying those vulnerable individuals. And that should really be the goal of the research, is knowing when it's useful and when it's not just it's never useful or it's always useful.
Right.
And really developing those markers and predictive ability that science brings to public safety, to research, and definitely creating ways of studying this that are reproducible. That, like, hey, if you run a similar clinical design in your lab on the other side of the country, you should get similar results. And we've been working on some research articles, including reviewing all of the metadata about some of the effects of cannabis on things like IQ and mental health. And it's really kind of all over the place.
Yeah.
And it's really amazing. It just seems that there are, of course, there is issues with intoxication, but how people interpret that is
absolutely. I actually just did a pilot study looking at mental health clinicians and their knowledge and attitudes around cannabis, and there is no uniform understanding of what abuse really means. And the findings were really interesting. And what the preliminary findings found were that clinicians who've used cannabis in the past actually were more likely to recommend cannabis for their patients. And that, because I think that really is a demystified kind of thing, is that if you've ever used it, that it's not the demon weed, that's going to make you crazy or do things or kill people or anything like that. And believe it or not, there are, within the mental health community, really, there is a bias towards, I would say that more of an abstinence-based focus rather than a harm reduction focus. And I think that's something that we really need to be looking at, especially with the opioid epidemic. And really, like Jahan said, there are so many different researches out there that we really want to kind of tease through some of that. I'm the guest editor for a journal, clinical social work journal, on cannabis and mental health. And it's fascinating. We have articles that I'm reviewing some of the articles that are coming in, and you can see there's a lot of bias in certain articles, and so those are some of the issues we feel, I think, fairly passionately about. Like, let's look at this, let's tease this out, and let's try to be as objective as we can.
Yeah, and I mean, because no one benefits when you do a bunch of research and spend a bunch of money just to confirm your own bias. It's not,
absolutely
doesn't advance the discussion further or add to our knowledge base.
Yeah.
And it must be frustrating to talk to mental health professionals who balk at the idea of recommending cannabis, but have no trouble prescribing opioids.
or benzos.
Yeah.
That's a huge issue for me. Anytime I have a patient who's on Xanax or even Klonopin for that matter, my antenna goes up just because I know it's so physically addictive. And most people don't, most patients go to their doctor thinking they're going to get help, but they don't understand really what that means and how quickly they can become dependent on something like this.
Yeah.
And for me, I would much rather see my patient utilizing cannabis in a therapeutic way to help kind of alleviate some of these, to have that anxiolytic effect on them. But then again, they need to know what are the better varieties for them, so it's a very complicated issue.
And I would say I think that people who are looking at this again, seeing all use as being negative or all use as abuse, are really just envisioning people consuming massive amounts of THC and not thinking about the other factors there that, mitigate the side effects or prevent intoxication. And I think that's
right.
That really
and
comes from,
what though, and that bias also though comes, I have to say, it comes from the research that's been out there and funded through our government. NIDA is notorious for really, they're wanting to look at pathological use of cannabis. That is what they're there for. And so as clinicians, we've grown up, if you will, thinking that that's what the reality is without really understanding that there was a bias present. We weren't really looking at therapeutic use. We weren't looking at uses that people actually were benefiting from. So
I do want to get to your report and the warning about CBD and get some specifics. This is really a fascinating read and really made the hair on the back of my neck stand up a couple of times. First, let's talk about did you actually do research or did you do studies of other studies, or how did you come to these conclusions about the CBDs, and what did you actually do?
This is a part of a longer journey, and it started probably more than a year ago, working with our colleagues, Marcel Bonmiller and Ryan Vandry, who invited us to partake in this CBD labeling study. And that was just looking at a very, very simple question. Do the products that are commercially available, do they match the label in terms of contents? What is expressed to be in there? So that's one of the things about analytical chemistry. When you're analyzing, you have to know what you're looking for. And we're like, oh, this says it has CBD in it, 10 milligrams. Let's look for 10 milligrams of CBD. And so we found that there was roughly a 70% chance that the label would be significantly different than what was in the product.
Wow.
And while we were in the process of designing the next round of research, which would actually look at contaminants, these researchers at Virginia Commonwealth University looked at some very specific products, these vape cartridges, which seems to be sold outside of a regulated market. So if you've either been to a gas station or a hobby store or whatever and seen CBD products sold next to lighter fluid or whatever, and then
Amazon,
or you've gone into a dispensary and then there's the state regulated dispensary, no one can get in without a card, but then they have this public access center and there's all these smorgasbord of products. That's sort of where they got these products from, is in this sort of gray area. And they found that they have these synthetic cannabinoids in them.
Well, before you go, did they mostly just test the vape cartridges, or did they test?
Yeah, that was largely what they did. It was a very targeted study for those inhaled products of sort of vape cartridges. And, because we were kind of scratching our heads when we were reading online reviews about people talking about how great these CBD products made them feel or how bad they made them feel. And these sort of subjective reports of intoxication are like, well, that doesn't really make sense for a CBD product.
Yeah.
And I have to say, I met this woman from Florida a few months ago when I was in Israel giving a presentation, and she was telling me about her friend who had ordered CBD and started to develop neuropathy as a result. And stuff like that really, that's where, from my perspective, and like I had said earlier, coffee shops. Literally,
Yeah.
like my local coffee shop down the street is selling CBD shots in coffee.
Or what they think is
what
CBD.
they think is CBD.
Yeah, and so there's all these little pieces, and one of them too that we had us scratching our heads was, you see in Utah, you're like, wow, 200 ER visits for these like severe anxiety and other issues, like people showing up holding this. That doesn't make sense. Is it a drug interaction?
Yeah.
What's going on? Other CDCs in other states are reporting people showing up to the ER with these products. It wasn't making sense. Like CBD plus inhaling it equals hospitalization. You're like, what's the missing piece?
Yeah.
It really, and then so.
And you said you found THC and a synthetic cannabinoid, which the label of which makes me think of Aaron Brockovich. It's
yeah. There was I can't remember the study, but they had actually looked at excuse me. They had looked at certain CBD products, and some of the CBD had ratio or percentages of THC that would have actually popped a drug screen.
Yeah.
So those, and so consumers don't know what they're getting is essentially what I'm saying, or what we're saying. And this is where, both Jahan and I and our passion about advocacy came out. We started just to kind of talk about this, and then it was more like we both agreed at the same time, like we need to do a consumer warning. This is something that people need to be aware of. Right. And
so THC, if that's in there, that could possibly be construed as they just don't know how to do processing. Is that right?
Potentially, yeah. Okay, I think
but with this synthetic cannabinoid 5-fluoro MB pin ACA F5 ABD, I didn't get that at all right. That's not an accidental thing. That's like a synthetic cannabinoid that somebody put in there deliberately. Do you think that's the case?
It's hard to say where it originated from. The people who are doing the packaging and filling of things could have just bought a stock oil from someone who put it in there for product differentiation. And this is actually something that we've been discussing for several years, especially as cannabis in general is being legalized. Is that when the saturated market, people might try some really crazy things for product differentiation. And, so this, I do not think this is a contaminant. Like, oops, we left too much THC in the process during harvesting and processing. And, it happens with hemp. Sometimes when you take that initial measurement, it's like, oh, it's below 0.3% THC. Then you remove a bunch of water weight, you remove a bunch of plant material, then that percentage goes up, and you're like, oops, too much THC. This isn't something like that, or like it fell out of the ceiling, or, like, oops, someone sneezed in it, and now there's a bunch of synthetic cannabinoids in there. At least you'd hope not. So it seems to be that it's an intentional adulteration of products for the purposes of, having some sort of product differentiation. Yeah. I think that's the most diplomatic way.
I can tell you're being very diplomatic. What other kinds of toxins? Did you find solvents, heavy metals, pesticides?
That is a great question. And so this group of researchers at VCU did not find those things, but that's actually, we have a proposal in place with some of our research colleagues to start kind of looking at different states and their CBD products for those things. And we're, one of the weaknesses that of some of these reports is that while the labs are top-notch people, some of them are like legacy chemists, like, their grandfathers were chemists, their grandfathers invented machines, whatever, instrumentation, but the methods are not validated by a third party. And so it's hard to know sometimes what exactly they did. And not saying that their results aren't credible, but I really feel like when you're making claims like these, you really have to take every possible avenue to bolster your results. And so one of the things we want to do is make sure the methods being used at looking at these contaminants are validated by a third party, like the ISO 17025 that's required for a lot of laboratories in the cannabis industry, to look at things that aren't necessarily required by regulations, like certain solvents, some additional heavy metals, or like you said, some of these synthetic cannabinoids. And I think that's something that we're putting together. And I think we've demonstrated here that there is a need from it, is that you have all these different groups. One report, like I said, on the CBD labeling coming from people we've worked with. Another independent group has found stuff. Another independent group has found stuff. And so we're trying to bring it together and say, hey, there's actually a really important need to sort of, nip this in the bud and really find out what the extent of this is before there's potentially public backlash or regular, more severe regulations come down.
Right. And my concern is that most of the people who are using this are looking for some kind of relief from mental health issues.
Yeah.
And if they're utilizing something that's actually exacerbating it, they don't know, you know what I mean? Like they don't know exactly what they're getting. And so it could actually cause a lot more harm. And obviously it does. It's sending people to the hospital than what they're originally treating.
Yeah. And then, we don't want to get in a situation, and you just imagine any organization that's out there providing education or resources for patients, and then they show up and say, well, this organization told me to use cannabis, so I went down to Bob's store and bought this mysterious product, and now I'm showing up to your clinical office with anxiety, confusion, and psychosis and tachycardia. And then they're like, wow, I told you not to touch that evil cannabis. And that's
we're going to get to that, but I just want to be clear. So right now, the things that people should be most worried about are the vape cartridges or the oils themselves, because like you say, you see CBDs everywhere. I actually have a volcanic ash with zeolite that you put on your skin to detox, and it is infused with CBD. So should I be worried about that, or people that use gummy bears, or you don't really have enough data yet?
There isn't a lot of data on synthetic cannabinoids being orally ingested or applied through the skin. They're primarily consumed through inhalation, and so I think very critically about the products that you are inhaling, and I think looking at those packagings extremely critically. In terms of being able to know where it comes from, its provenance. If there are, one of the big sort of red flags that any consumer can use is if there are fake certification seals. Like they're not really from a certification organization. It just sort of says certified, and you're like, to what? By who? So that's one thing that you can use to kind of filter out.
And I think that we're all on the same page, that we all agreed that best practices would be to know your source, to get it from a dispensary that is more regulated than just buying it from Amazon or another vendor.
Let's go over some of the problems that have been reported. You said 200 emergency room visits in Utah. What kinds of reactions are people having? What's sending into the emergency room primarily?
I think there's probably been, that we were able to find, over 2,300 incidents involving these 5-FADB or Fubinaca compounds since 2017, and many of them show up for 5 non-fatal clinical, sort of intoxication effects. And so, like I said, the main 5 are severe anxiety, confusion, psychosis, tachycardia, and psychomotor agitation.
Which is kind of like a hypervigilance, like I don't know how you would describe it other than just really agitation physically.
And are they primarily short-lived? Is there lingering problems or ongoing problems, or is it just a one-time occurrence?
It can, well, if you're the user, it can seem to last forever.
Especially
I think the data is really out on that now. And that's the one thing we just, we don't even know exactly what the long-term effects could be as well. Okay.
So you see reports, and you talking to some of these people who have, psychonauts or whatever you want to call them have tried these products say, well, it was great. I was at home, we were watching TV, and then I just had to go down in the basement and sit in the dark for a couple hours, and that doesn't sound like the greatest experience in terms of, that's like exactly what a rat will do when you give them these compounds. It's like, I need to hide in the dark, less anxiety, less stimulation.
Well, it would kind of lead to full-on panic attack, too, if you're having tachycardia and it increased anxiety. It can make you feel like you're about to die and could lead to other kind of...
So you're kind of spinning the wheel of fortune. You're like, is it going to land on 5 minutes or is it going to land on 2 or 3 hours? Yeah. Am I going to wake up tomorrow with a synthetic cannabinoid hangover? We really don't know, because there could... they only have reported what they found. They did, in terms of what other things are in there, what other, when you synthesize a drug, it's never 100% pure. There's always the little things. When you go and buy, an amino acid at the grocery store, like a supplement, it's 95% pure. There's 5% of other stuff there left over. And so I think that's something to think about. Also, how these drugs are metabolized over time. Yep. Some people have found that some synthetic cannabinoids, when they're metabolized, supposedly broken down with the body, they become more potent. Some of the things that the liver or other enzymes turn them into for excretion. And so you might find that the initial onset isn't so bad, but then your body's like, hey, watch what I can do. And then suddenly it becomes more potent. Like, think about taking THC orally versus inhaling it, right? After it passes through the liver, it's a little bit stronger than you might have anticipated if you had inhaled the same amount. So there's some unknowns there in terms of what happens to these drugs over time and their effects over time. Yeah. But it seems that they last long enough for people to say, you know what, this does not feel good. I need to go to the hospital. Wait in the ER, then wait to see the doctor, get diagnosed. So I think that we can, infer that these symptoms are lasting for a significant amount of time. But again, it is confusing because there are synthetic cannabinoids that last for 15, 20 minutes and the effects dissipate, and there are others that are much more potent.
Yep.
And this, just so I make sure we understand, when you say synthetic cannabinoids, these are some kind of substances that actually do engage with the endocannabinoid system. They attach to the receptors, the CB1 to CB2 receptors. And so that's why they're synthetic marijuana. It's not that there's any actual marijuana in them.
Correct. Right. And I think that's also a little bit of a misnomer. Having done a couple of court cases as an expert witness on synthetic cannabinoids, I can tell you most people don't care if they stimulate other receptors that people don't really know about. If it stimulates CB1, they're like, synthetic cannabinoid. Right. Even if it has a host of other activities, that's the most sort of popularized effect you can think of.
So have you been able to find any deaths that have occurred because of any of these substances yet?
Not from the substances alone. Usually there are other narcotics or drugs involved in polysubstance use. And there's been a few face eatings and other things that have been reported, people getting in fights at traffic stops and biting a guy in the face, and he was on I think it was in Florida a couple years ago. So there's been some really kind of wild stories out there.
And we don't know much about the drug-drug interactions either.
Yeah. And I would think that if somebody has a damaged immune system or is already fighting off other conditions, cancer, whatever, this can be even more troubling and more. Well,
if you have PTSD, for example, you're already hypervigilant, you're already anxious, you already are struggling with flashbacks and stuff like that. If you're ingesting something like this, it can actually exacerbate. I would assume that it would exacerbate the condition.
I would have to double check on this, but I think in New York about a year or two ago, there may have been some deaths in the summer that were attributed to both like the heat wave combined with use, where they found just a group of people really in a 1-block radius who were kind of acting like zombies. And I have to double check if that was combined use with like fentanyl or other opiates and synthetic cannabinoids or not. But that would be something we could
we could look into.
Yeah. Well, most people consider cannabis to be generally safe. There's, all the Facebook memes about how no one's ever died from it. You have to smoke a 1,500-pound joint in 15 minutes in order to achieve the lethal dose. Is part of that feeling of safety why people are not more up in arms about the CBD situation and the toxins you're finding?
I think so. We attribute cannabis with something that's non-toxic and safe and been around for thousands of years. So when we call something synthetic marijuana, I think that just you mean something that's been safe and proven over thousands of years that's synthetic. It's like, no, that's actually the probably worst possible description, I think, for these substances.
And you made a really good point in your release, too, that the good, decent, honest CBD companies and the industry in total are suffering from
absolutely
damage from these kinds of things, right?
Absolutely. Absolutely. And that's where, we support legalization. We support regulation. We were really hopeful that this wouldn't be one of the concerns we had was that these kinds of findings would actually lead to more restrictions as far as attempts from our federal government to keep it illegal, but we really feel that there are good products out there, and we want people, consumers and patients, to really understand that you have to know where it's coming from. You have to know the source, and that don't just try it because you found it on Amazon, or don't just try it because it's at your coffee house. There are some significant issues here, and we're really about trying to educate people, because we don't, I got into this business to help others, not to harm others. Both Jahan and I did. And as a clinician, I want to make sure my patients have the best care possible. And this is, just an extension of that. And that's why CMH, why we're here, is really to kind of blend our passion to help patients.
And I think it's an opportunity for companies to differentiate themselves from this issue, and really champion their, hey, look, we know where it's coming from. We have these certifications. We follow these standards. And I think it's a really important time to differentiate yourself from these other companies. And I can't stress, that enough, that, I think that there are a lot of good CBD manufacturers and companies out there, and I don't want to see them bear the brunt of the backlash to this. And I really would encourage the industry to issue similar statements that they don't condone this type of behavior, and even issue recommendations for companies to distinguish themselves. I would love to see some cannabis association have like a designer drug sort of thing that companies could sign on to and pledge, not to engage in this sort of questionable behavior.
One of the reasons that it's really important to know where your source is coming from, as I understand it, hemp and cannabis are plants that will help remediate soil by extracting the heavy metals and so forth out of it, but then all those heavy metals are in the plant. Is that basically one of the biggest concerns?
Yeah, so there are many species of plants on the planet that do that. Cannabis is one of 200. And so I think the most easily conceptualized use of this is it's been hemp varieties near Chernobyl to clean up the soil. And it stays in the plant, and it's just a way of transporting those heavy metals somewhere to be used. And so definitely, I think paying attention to what you're putting in there. And I think that's part of the allure of hydroponics and these other customized systems, is you can really control what's going in to the plant and what's being potentially retained in the stalk and leaves.
Sure. Well, I've been aware of this problem for a while because friends with the woman who created the Palmetto Harmony Company, and she has a daughter that with a severe intractable epilepsy that she heard cannabis was a good option, or CBDs were a good option. And she would not give her daughter anything until she had it tested independently. And she literally only could find one product that didn't have solvents, heavy metals, pesticides, THC, all sorts of ugliness in it. So she literally had to start her own company to grow it for her daughter. That's a mother's commitment right there.
Yeah, no, and I've had similar experiences, having been in this field, research and industry for now like 15 years, going back home for the holidays, I never really had much of a conversation with my brother-in-law. And then one year he was like, I want you to meet my best friend. And I'm like, where's this coming from? Like we haven't even played basketball together. And he took me over to their house and they had a kid, their infant had childhood epilepsy. And they had 2 cupboards full of CBD products they had bought and tested independently. And they were just at the end of the rope and didn't know what to do because they were having similar issues. And similarly, it came down to introducing them to someone who had a company locally, who was producing it locally, and that they could interact with literally on a one-on-one basis and really make sure they were getting what they needed. And I hope that in the future those stories become, fewer and fewer because of the standardization of products.
Absolutely. Well, so what can the consumer do? What is the most positive steps to take if one wants to buy any of these CBD-only products out there on the free market?
One is educate yourself and think critically. I like to think about it as asking annoying questions. If people can't tell you where it's produced and they're like, it's either China or here, man, I don't know, like that, you're like, okay, no thanks. You don't know where it's from.
And if it comes from China, we should be very careful, right?
I mean, because that might just be a buzzword for we don't know where it comes from. It may, it just, where does it come from? I don't know. Everything's made in China. Like it's a really non-specific. China's huge, like north, south.
And I have to say, I'm concerned about the gummies, mints, all of the chocolates that are out there that I've seen them in health food stores that they don't know where the CBD comes from, and there's a product that they're selling and they've just heard that it's helpful. And so I'm concerned that these companies whether it's a coffee shop or a health food store or Bob at Bob's gas station selling this, they don't understand the reality behind what they're potentially selling. And
just from a medical standpoint, though, if you're selling something to be an anti-inflammatory and then you put it in a product that has sugar, which is the most inflammatory product we can eat practically, kind of cancels each other out, doesn't it?
Yes.
And I think, the other thing for the consumer, in terms of just simple things you can do, is compare the label to other regulated products. Even the can of tuna fish you get at the dollar store has seals like Dolphin Safe, websites, 800 numbers to call. It's a legitimate packaging.
Right.
False seals are a good false flag. I mean, it's a good.
Yeah. If you don't recognize the seal or emblem, look it up. It should have a trademark. It should be traceable. And you should be able to look down some stuff. And if you don't have the time for this, then maybe you shouldn't be buying products that you can't clearly identify.
Right.
And if you already are, say, a registered patient or an adult cannabis user and you're accessing it through proper channels, those products come fully labeled, right? And you can compare the labeling on a product you get at a licensed store through proper channels to these products. And if it doesn't match up, I think that's some of your red flags to say maybe there's something off about this product.
And sadly, we know that not all the states have legal CBD products or legal cannabis products. And it makes me concerned for consumers in states where they don't have legal programs because they're more or apt to get a hold, they've heard about CBD or they've heard about how it can help them. And then they're the ones who are more apt to kind of get products that aren't tested. And so I have concerns for states. I think it's a state, I think the states really need to look at their programs to make sure that consumers have access to quality products. And, that's why I think, there are 33 states, I think, that keeps changing, that have legal programs. And, so that means we have God, that's addition. That's 17 more that don't, and so I can tell you my mother, her friends, they're really kind of cute about it. They're the Red Hat Society, and some of her friends utilize CBD. And of course, for my mom, who's 77, she had no clue anything about this. And as we were talking, she was like, I have to tell my friends not to do this. How can we get legal stuff? And unfortunately, she lives in a state where it's not legal. And so they don't have access to that. And those are some of the concerns I think that we really need to,
Right.
advocate for states to provide this legally to people.
Well, and that's the final point that I want to finish up with is that if, as in Pennsylvania here, we have a very highly regulated, very controlled, very tested state permitted dispensary.
Yep.
We don't have to worry about any of this stuff that's in your report, do we? Or don't we?
I think that is a really good question. And the part where I think I am concerned about it is I have spent part of my time doing assessments with states on compliance at their dispensaries. And one of the potential sources of this could be when these dispensaries who have products produced in their state, which you would need to be a registered patient to get, they also have a section for the public to come in. And it's this weird sort of catch-22 thinking where it's like, well, if it's produced in the state, we have to put it in the state program. But if we buy it across state lines, we can sell it to anyone. In the left side of our store, where the T-shirts are sold, we'll sell these CBD products. I think that's the potential access point for some of these products, and this is where I think companies have to really be careful about what products they are allowing to be in their store, because they don't want to trigger an FDA or DEA raid on their facility, not because there's cannabis there, but because they're selling something that isn't cannabis. And that is the danger, is that there are potential real ramifications. We've seen CBD raids, which could have been potentially because they thought there were synthetic cannabinoids in there. Texas, and in other states, this has triggered in law enforcement activities. And we think that it's worth getting the proper documentation, getting the test results before these products are put. Ideally, you wouldn't want to have a separate section for accessing what is essentially cannabis for different groups in your dispensary. But if you're going to have it, be very, very scrutinize the products that are going in there that you're getting that aren't produced in your state. And
we're really just trying to advocate for having products with standard practices and compliance, whether we would like to say that all states have great products and offer great products, but we think that there probably needs to be a lot more, I would say compliance. I hate that word, but around their practices and making sure they're following GMP practices. So.
But by and large, I mean, here in Pennsylvania, it's only the medicinal. We don't have the recreational. So they don't have those separate rooms like you're talking about, Jahan.
Yep.
So, but basically, if we buy cannabis that was grown in our state through a regulated system, very, very little chance that any of these problems are going to crop up.
Yes, I think that there are very little chances of those things cropping up. But, I think this can also be a message to the patients of Pennsylvania saying, well, the local dispensary doesn't have the product, so I'm going to drive across the border.
Well,
you know, Pennsylvania for years, you know, hey, this wine isn't available in my state. I'm going to go over to Jersey.
And let's be honest here too. These programs, which they're wonderful to have, the state medical cannabis programs, they're also very cost prohibitive to lots of patients. That they can't, you know, their insurance doesn't pay for it. You know, if you have someone with Medicaid, you know, they're having to pay, $200 to get a card, and then they're still having to pay for their product out of pocket. Well, they're on Medicaid. And so this is not a simple issue. This is a very complex issue. These are some of the issues. So even if PA or Delaware or New York, you know, they have these legal dispensaries, it doesn't mean that patients are going to utilize them because of access to care issues. And so that's something we really need to kind of look at as well. And most of the dispensaries don't have programs for people who can't afford this. And to me, that's a huge issue. I know in our practice, we see a huge percentage of Medicaid patients, and they don't always have the money to be able to afford this. You know, I've advocated for, I can think of one patient who had severe trauma who, you know, they got the card in Delaware, but couldn't actually pay for the product, and the dispensary wouldn't help them. So these are kinds of the issues that we're struggling with as a society. You know, Jahan and I are very familiar with this, and for me, from the patient side, you know, I think we need to be looking at making this accessible to everyone. Yeah. So that people don't go to Amazon, or they don't, you know, I'm sure there's a mindset where they're like, why am I paying $200 to get a card and still having to pay out of pocket for this? I can just order it for $15 at the gas station down the street. Right. You know, so we need to be careful about that.
Just one final point is, and this could be like a whole nother podcast. So I'll just look for short answers here. It may be a little off the topic, but does the research show that CBD alone has certain benefits, or does it need to have some THC in it? In general, I know there's a lot of different conditions and things, but are you an advocate for CBDs alone in general? I guess is the best way to phrase that question.
That's a challenging question.
I know. I can hear a whole nother podcast coming.
I'd say yes and no is my scientific answer. And I think it depends on what condition you're looking at and what administration route you're looking at, and also whether or not the person is polypharmacy. That is, if they're on 7, 8, 9, 10, 12 medications, it can be more complicated the more drugs you add in the system through the oral administration route. But,
and we're working on an educational piece about CBD because we kind of want to demystify it as well.
But I would say overall, if I was to, say I have a bias, is that based on the literature that I have read and the research that I've done, CBD seems to enhance the ability of THC. Yeah. And I would say that THC, CBD, and other compounds from the plant seem to enhance, have additive or even synergistic effects. And that was indeed the first research study I ever did, was actually many years ago, looking at the impact of combinations of cannabinoids on brain cancer cells. And so ever since then, I've thought strongly about this issue and see that the greatest potential is in the combinations and ratios of these products working together.
Absolutely. Absolutely. Well, it's been a lively and fun conversation. Is there any points that we missed that you want to make sure we cover before we close out?
I think we kind of covered it all, didn't we?
Conference.
We'll do that later.
We'll have some great updates for next year, including, we are working on getting a research journal out there, some conference going, focusing on some of the stuff we've talked about. It's
really, we see ourselves kind of as bringing people together who haven't traditionally worked together. We really want to bridge the gap between the basic research and clinical outcomes with our patients. And so I think that we have a lot on our plate right now, but it's fun, to be honest with you, because it's very unique, the work that we're doing.
this industry is one of the most exciting, challenging, rapidly changing, crazy industries I have ever been involved in. I love every minute of it.
Yeah, us too. Us too.
Well, Jahan, Marcu, Jan Roberts, thank you so much for being with us today.
Thank you. Thank you. Look forward to talking to you again.
Oh, I look forward to it. Thanks.
All right.
That concludes this episode of the Dispense Magazine podcast. We hope you'll take these warnings to heart and be very cautious when buying unregulated CBD products. I'm Sven Hosford. Thanks for listening. This podcast is a production of Mindful Medicine, LLC.